some people just want to get out a knife and start cutting people up.
Surgery, I am a surgeon, and surgery is an important tool. So we say that two sides of our face in particular are cousins but not sisters.
I think I might have tech neck. Do you know what that is?
Next thing you know, someone's down a rabbit hole about their neck.
Do people get addicted to it?
Yes. I see people when they come at vulnerable times.
Do you see a big difference in their confidence?
Oh my gosh, yes. Only women get cellulite. Men don't.
I've got like 2 sunspots that I hate their guts. What do you think is like the best thing somebody can do if they want to look younger?
Yes.
With Aimee Mayo. This is Wait What with Aimee Mayo, my new podcast, and I'm introducing my next guest, Dr. Biesman. He's like a plastic surgeon to the stars. He's been in everybody's house. He's been in all these celebrities. He won't tell you who. He won't tell me who, but I kind of know. But he does work on everybody. My friend that's a country singer turned me on to him a long time ago. And when I went in his office, we bonded on Metallica. And I was like, I didn't know like doctors love Metallica. And that's what first made us really connect. Like, and then we liked all the same music and Ozzy. And I was so sad when Ozzy died. Like, but he just is so smart. He does all kinds of research. I trust him. And I feel good saying that. He's got 5-star reviews. I check reviews for everything. Like, I ain't doing shit without a good review, especially to my body. And so he has great reviews and he does a lot of things. And what I really love is like, I feel like you do things that aren't invasive. Like some people just want to get out a knife and start cutting people up. But you don't do that. And I think that's really good because I think you can do a lot of things and get the same results, like without that.
Well, first of all, thank you for your lovely words, Aimee, and for having me. Surgery, I am a surgeon, and surgery is an important tool that sometimes you're not doing people right by not telling them they just need surgery. Because you can waste people's time and money if they just really need surgery. But you're right. There's a lot of things that surgery doesn't do that are important for aesthetics. So sometimes they need surgery and sometimes they need laser and sometimes they need injections and sometimes they need to go get a dose of self-confidence and not get anything done. It just really depends on the individual and what their goals are too. Because sometimes I'll look at someone and I'll be thinking, I can do this, and this. And all they're concerned about is a little mole or something. Like,
yeah.
Okay, if that's all that bothers you, we'll talk about that.
I got a weird question, but I think a lot of people might feel this. So, like, how much do you feel like when somebody comes in wanting you to do something, do you think how much do you think it has to do with, like, insecurity about something that somebody else gave them? You know what I mean? Like that somebody pointed out. Like I know one time I was in a office to get a facial and this lady was in front of me talking about some freckles on her calves and it's like, what? Nobody would ever notice that, but I figured somebody probably told her that. Somebody probably pointed that out and she's been worried about that ever since.
If this were 10 years ago, I'd say 100%. Today, I'd say it probably came from social media in some way. That they saw someone or heard someone, and it was probably with a filter and probably not real, and people going on about stuff that's probably not accurate. But it gets in your head sometimes, and it makes you think about it. And it could have been someone said something, and then you see people. I see people when they come at vulnerable times. They got relationship changes, they got job changes, they got they're child just leaving the house and they're feeling like they're at a crossroads of some type. And I don't think that's the right time to make big decisions. You can make little decisions, but I encourage people, just be careful of that. But, you're right. The motivation behind what led you to come here and talk about that, that's a really important question that, again, most people don't think about that. But you got to dig deeper and figure out.
I love a doctor doing that. That's what you want your doctor to do. You know what I mean? Like what you just said about the vulnerable time. People coming at, like, say they're going through a divorce and their husband like married a younger girl. It's like, and they're feeling self-conscious, like about this, that, or the other. Maybe somebody made a comment, and then I love the vulnerable, that part.
I only hear that about 10 times a day from people. There's like some vulnerability. And, look, there are times when it's okay, because if there's something that you're really self-conscious about and you've been waiting for a reason to actually address it and have the confidence to address something that does make you insecure, well, that can be empowering. But there's other times when they're just devastated. They don't really know which way is up. That starting to do procedures on them isn't necessarily what they need. They need something that goes a little bit deeper to help them get their heads.
Do you sense it right away?
At this point, for the most part, yeah. At the very least, I sense that we need to have a longer conversation, especially when people are asking for things that don't seem to make a whole lot of sense.
Yeah.
When you look at them, and it's like you were saying with the freckles on your calves, it's like, you got what?
Maybe their husband made a weird comment once and they got like hung up on that one thing. That, I noticed one thing, like I noticed something, my friend, okay, so I was on the cover of this magazine and I'm not used to stuff like that. So I can't imagine how a celebrity might feel that's getting taken apart all the time. But so I was on the cover of this magazine and they sent the files in like a Dropbox. And so they're leaving notes on what they think the cover should be. And I keep seeing these notes about you should fix her neck here. You should do this here. Like and my daughter's like, why do they keep talking about your neck? Well, first of all, I've never even thought about my neck. I've never had a worry in the world about my neck. And ever since that, like I'm wearing a turtleneck tonight. I still think my neck's okay, but I think I might have tech neck. Do you know what that is?
Oh, very much so.
Well, of course I'm going to have tech neck because I'm a writer. I've been looking down for like ever, but like it, it's part of who I am kind of. It's what I've done forever. But ever since I saw those notes, I've worried about it.
It's so hard in these times, again, back to social media, where people can write anonymous comments about you, what you look like, what you dress like, how you do your hair, how you do this. And it could be someone who is just being nasty, and doesn't mean you look bad. They're just being nasty. And people make notes. And sometimes the other thing is that the people looking at your photos, the reality is they need to have a job, right? So it's sort of like when you have an auditor come, they're going to find something because that's their job.
That's what they're supposed to be like. That's how they make money.
If there's nothing to find and they don't find anything, then their existence is called into question to some degree. There are auditors who will tell you, you did an amazing job, but some people will come in and they will find something no matter what because they're paid to do it. And when it comes to artistic things, someone's aesthetic, there's different opinions too. And there are people who can have legit opinions, and there's people who can say, you know what, she's beautiful. I tell people that all the time. You know what, you are beautiful. I think one of the things I said, I think the relative risk of doing this outweighs the potential benefit. And if you were a member of my family, I would tell you not to do this.
I love that.
Because some people just don't need stuff. And there's other people where having stuff done is an activity, and they get an opening in their schedule because work got canceled. They're recording something and they had a break from it, and somebody was sick and they're not recording that day, so they're looking for something to do. So they're like, "Oh, can I get in? I need to get. I just saw you last week. You're fine." No. There's this one spot. Ultimately, it's an activity, and then the challenge is how to tell someone who's determined to get something that you have to be even more determined not to give it to them because they don't need it.
God, it's got to be so hard. It's got to be so hard. And it's not even to do with anything except for they want it and you're trying to help them.
Yeah, that's exactly right. But, there's times when I help people by actually doing a lot, because sometimes people who, again, this is 2025, almost 2026. One of the hottest things around these days is GLP-1s. People taking the shot to lose weight.
Oh, shit. You mean like
Ozempic and all that stuff? Yeah. So there's a bunch of different Ozempic and Mounjaro.
Is that dangerous?
Like anything else, it's dangerous if the person doing it is not monitored properly. It's dangerous if the person taking it shouldn't be taking it in the first place. But if you're someone who is legit,
I'm taking it.
For someone,
is that wrong?
No, again, I don't.
Once a month. I do it once a month.
Well, that's not very much.
No, but I don't want to get my face all sunk in, you know?
And that's sort of where I'm going with it, is when people sometimes have a lot of changes, either because of weight loss or sun damage or something where, they've got legit a lot of change because they've smoked and been in the sun for the first 50 years of their life and suddenly decided that they're at a crossroads in life and they want to turn over a new leaf. Well, they grew up in South Florida. Their skin is almost like leather. They look like they're 70, and you're like, you can't do a little bit of Botox and expect that person, that isn't going to accomplish anything. So that's someone where you either go big or go home.
Yeah.
And I tell them, you got to do a lot. And sometimes the conservative thing is to do a lot, because if you don't do a lot, someone's going to be wasting their money. They're not going to see anything. They're going to spend a fair amount and just not see anything. So either you do what they need or you don't do anything at all. And other times, the whole goal is to think, how little can we do? Because you just don't need much. And sometimes you take someone really attractive and you can just tweak things a little bit and make them actually even a little bit prettier.
Yeah.
Or a guy more handsome. We see men too.
Is it symmetrical? How does that part work?
Yeah. So we say the two sides of our face in particular are cousins, but not sisters. So they don't look the same, but they look related.
Is your whole body that way?
I tell that when we're talking about surgery, my standard line, you draw a line down the middle of the body. The two sides are not going to be the same, whether it's hands, feet, eyelids, earlobes, breasts, knees, anything people complain about, buttocks, they're going to be somewhat asymmetric when you start, and they're going to be somewhat asymmetric when they're done. But the problem is people get something done, they're sitting around recovering, and they got nothing to do but sit around and look at themselves in the mirror as they're recovering. Then they notice all these things. I had a patient one time who swore that by doing her eyelids, her eyebrows moved further apart. And she came back and said, my eyebrows were never this far apart. I said, I'm sorry, but there's nothing that we could have done to your eyelids to make your eyebrows move apart. She said, they were never like this. So we pulled out her pictures from before surgery and showed them to her. She looked and said, well, I just never noticed. Oh, wow. Well, which is because they just focus on themselves a lot more. And I get it. You got nothing to do. We tell you to take it easy, use cold compresses, no activities, just give yourself some downtime. And sure enough, people start noticing things.
What do you think, how much do you think insecurities come from shit other people said, making, I'm talking about that thing about they're talking about my neck. Only one girl was talking about my neck, but my daughter's like, why they keep talking about your neck? am I like, then it made me I've got a turtleneck on right now. It made me self-conscious, like, and that's just one person talking about that.
Yeah, I think it's definitely a mix. It's probably less that someone told them, hey, you need to get that fixed, versus all the chatter about people talking about getting their neck fixed. And they got 3 friends who got their neck fixed. And then they look in the social media because someone was talking about it. Then what shows up in the social media but people getting their neck fixed. And next thing you know, someone's down a rabbit hole about their neck when they never thought they had an issue. And so I think it's more the implied messaging or the things that you hear than someone flat out being told you need to get that fixed.
Yeah.
There is some of that.
Just making
for
a little
sure.
comment about it.
Yeah, that's less.
Have you seen a bunch of change with social media,
God.
when it comes to people's looks and how they're trying to fix themselves?
1,000%, yes.
So when did it start?
Probably about 10 years ago, about 2015, I'd say is about when the things really...
You saw a big difference starting then?
Well, it was little differences starting then, but then it kind of evolved. And I'll tell you what, probably if there's a big difference, it was probably COVID.
I thought you were going to say the Kardashians.
I mean, the Kardashians
when you started with the
certainly
C.
played a role. Any high profile people who talk about doing stuff definitely play a role. But when people were in their house during COVID and they couldn't go out and do as many things, a lot of places were closed. I think that's when things really blew up in a huge way. And it also became, in a good way, it became much more accepted to have things done. Because if you think about it, I mean, the reality is people dress in nice clothes, or the clothes that make them feel good about themselves. When men get their hair done, they get their hair colored, they get their teeth done, they exercise and keep themselves in shape. They wear shoes that they feel comfortable in. I mean, all of those women wear makeup.
And it gives them confidence.
Why? Because you want to present yourself in a certain way. So why is it such a big deal if you don't like the fact that you've got wrinkles that you didn't used to have, that you want to have fewer wrinkles? Like, how is that really any different?
It makes perfect sense.
I mean, it's not really any different. It becomes problematic when people see things that aren't there. They come in and say, well, I want to get this stuff fixed. And like, well, what stuff do you want to get fixed? Well, I know you can see it.
Can you see it?
Just let's assume I can't, and tell me what's up, because they're beautiful. Like, they have nothing. So those are people, and they're insecure, and they, and I feel sorry for them.
I like the vulnerable thing you said. I feel like there's so much truth to that. Like, some people, you could say one little thing and they'll spend every cent they got trying to do stuff.
You're exactly correct. I mean, you mentioned celebrities before, and I have had the privilege of working with lots, as you've said, and it's really hard for some people. No matter, and you must think, or many people think, oh, well, at a certain level, you just ignore that stuff. Well, some people don't, and it's really, really hard for them. I couldn't ever handle that, I don't think.
I don't watch anything. Like, I don't want to see it except for, or my shoes showing, or what, on this thing, on the podcast, I'm like, what angle is this at? Like, or my shoes showing, am I sitting up straight? That's all I want to know about. Just like I learned one big thing with my book, comments like on the book, and I think it's the same probably with like with people being critical of themselves. Like, all the comments, like anything negative ever, it was either profanity, which that was one thing, but that I don't care about that. But the other thing was like something personal to them that, like, you know what I mean? Like, one of the biggest comments that stuck with me forever was this girl said, because a lot of people talked about my book being funny. And she's like, this book isn't funny at all. Like, because there's traumatic stuff in it, but it's all how you handle that stuff. So I realized everybody's talking about things that have to do, it's about them, not me. You know what I mean?
Mm-hmm.
Same thing I feel like with what you're doing. You're dealing with all this stuff that, like, what's been told to them, what they think, what their mom said. You know what I mean? Like all these different things.
You're 100% correct. But my job really is to be the objective voice of reason. Like, no, you don't need that. You look amazing. Ignore that. You know, if there's something about your face, I mean, there was someone who was in today who's public figure and so forth, and she's beautiful. And she was feeling vulnerable. She'd had several children. She said, I spent the last several years either pregnant or breastfeeding, and she was feeling kind of down, and she noticed a tiny little bit of something along her jawline. I mean, yes, it was there, but looking at her, you think, this woman is beautiful. I'd never met her before. She's beautiful. And I told her, you're beautiful. And she said, yeah, but what about this? I'm like, okay, I mean, you pointed out, it's there. If you wanted to treat it, we could do these non-invasive things. And if that will make you feel better to do that, it's not wrong to do it. But if you ask me objectively, do I think there's anything that you need to do to be more attractive? No, I don't think so. And sometimes it's a matter of someone saying, I just feel like I look tired, I look this. Or they use these different sort of general adjectives. And then my job is to kind of figure out, well, is there a physical correlation here, or is this a deeper issue where maybe we need to not worry so much about this wrinkle or line or bulge, and we got to take it a little bit deeper than that and help them get to where they need to get what they really want, which is some inner peace.
I love inner peace. That's good. How much, like, do you think people come in there after a divorce? Is that pretty common?
Oh, extremely.
Or after
I mean, they come in before their wedding. They come in after a baby. They come in when a divorce is imminent, when a divorce just happened, when they're going to be taking a new job, when they just lost their job. Yeah, there's...
they start blaming that stuff on their looks, maybe?
They don't blame it on their looks. I mean, anyone who feels like if they make an investment that they're going to get a significant other or a job or something else, I don't want to go anywhere near that situation. But it's more like, well, I haven't been single in an awful long time, and maybe I need to get myself together.
I know so many women that have done that.
Or to your point, something was said during
their marriage or something.
Times, and and they feel bad about themselves for whatever reason. Or there was a younger, more attractive model that came into play, and I mean, they do feel, but they're feeling down. And sometimes, honestly, a little pick me up goes a really long way for them. And I just try to kind of sort out, is this someone who's going to benefit from doing something now, and how much should we do? And other times you see people who go through all that stuff and they're like, oh, yeah, I'm fine. Went through all that. But I think I wanted to talk about people who break my heart. This woman in the last year had a death in their immediate family. Their house burned to the ground. They lost all the memorabilia from the person who died, as well as all of their other possessions. The insurance company's given them a terrible time, like all of these horrible things. And she still comes in regularly for her Botox injections because it makes her feel good. Like, oh my God, like seriously?
Well, it matters, it matters to people. It's how they present themselves to the world. I mean, like if you're not confident and you go into a meeting or you're trying to get a job or something like that, that stuff matters, like I remember this friend talking about when he wrote a memoir, the only thing, like he was so worried about upsetting his mom, but the only thing that upset her was how he talked about how she looked in one part and that she just never got over that, and he was like, I just would have never dreamed, that she would care about that as much as she did. But people, I don't know. I don't think people really think about, like how I feel like sometimes people just don't think about how people feel with things they say. Like some dumb thing about varicose veins, or somebody makes a comment or something, like, because I know somebody that just went through all this thing and they thought it was going to be an easy surgery, but it ended up not being an easy surgery. And they were just like, I think expectations too, like with surgeries, like you think that this is going to be so smooth sailing, and then it's like more painful than you thought or something. But I feel like people, like there's so many little things with people that other people don't know that they're feeling.
You're so right about that. And sometimes offhand remarks that you really don't mean to be critical or mean. Sometimes you just hit a spot that you had no idea was as sensitive as it is, and it can really set people off.
So when somebody comes in, like, okay, I got a good example. When somebody comes in and you see something that could be better, that could be fixed, like if they act like, do they need to ask you, or do you tell them without them? How does that work?
Well, it's a really insightful question that you're asking. And the answer is that it depends. I kind of try to read the room a little bit. So some people come in and they are very focused and very results oriented. And they say, Brian, I just want my eyebrows up and I don't care what it takes to do it. They can do surgery, do not do surgery. I don't care what, but I want my eyebrows up. And they're very focused. So that's an easy conversation to have because they're telling you what they want.
What if you think they need something else?
So that's when we say, usually what I'll say is, I'm happy to talk to you about your eyebrows. Would you like to focus on your eyebrows, or would you, and limit our discussion to that, or would you like me to give you any suggestions or ideas or thoughts on anything else? And I'd say probably 99% of those people say, well, yeah, what else are you thinking about?
Yeah.
And sometimes I'll say, look, it doesn't matter to me at all what you do or what you don't do. I honestly don't care. What I do care, though, is that when you leave, you're happy. And sometimes people get so focused on a certain thing that they don't see something else until you fix the thing they're focused on, and then they realize there's other problems too.
Yeah.
And what I don't like is when you do surgery, especially if you do surgery, but you do any treatment on someone and you uncover something else that was there if you just called it out in the first place. Because there's a saying in what I do: beforehand it's an explanation, and afterwards it's an excuse.
Oh, wow.
So it's like, oh, well, let me explain to you all the things that are contributing to why you feel like your upper eyelids are heavy or whatever it may be. Or rather than waiting until after surgery when I just did the brow lift, but I didn't take off any extra skin from the eyelid and I didn't tighten the eyelid muscle. Like, well, you didn't ask for that. And yeah, we could have done that. And then you're talking about doing more surgery, and that's just not.
Do people get addicted to it?
Yes, they do. But again, just saying no is
just because they're bored or whatever. What do you think's the deal?
I think, and just my opinion after 30 something years of practice, the people who are bored usually aren't asking for surgery. They're usually asking for lasers or injections or chemical peels or something like that. Something they can go and get that day.
Yeah.
They're not asking for something that they can get when your schedule allows it. That's a deeper drive, I think, when it comes to surgical stuff. And what drives The surgical request tends to be, I would imagine, a deep-seated sense that you're not looking the way that you want to or you think you should. And too much of anything just isn't good, whether it's filler or surgery. Do you see a big
difference? Do you see a big difference? Like when somebody comes back, when they're healing from some like an eyelid thing or whatever, or eyebrow lift, do you see a big difference in their confidence?
Oh my gosh, yes.
That's why you do this.
That's the most fun part of my job.
Yeah.
It really is seeing people who felt insecure about things, who feel confident. One of the things that I do a lot of is treating scars and acne scars in particular. But there was this one girl, I mean, she was a girl. She was 16 or 17 maybe, and young woman, but young. And
what kind of scar?
She had acne scars. And when she first came in, she was naturally blonde. Her hair was like green and purple, and she wore these real low-cut clothing. So basically, it was everything to get you to look at something other than her face.
Yeah.
And we talked to her about treating her acne scars, and her parents, of course, were there because she's a minor. And we said to the parents, like, are you guys on board with this? And they said, no, we think it's important. So after a lot of discussion and several meetings and so forth, decided to go ahead and do her treatments. And she came back. I didn't even recognize her because her hair was a regular color and she was dressed professionally. And I was like, oh my God. I literally had to look down at the name of the chart and see who this was because I literally didn't recognize her. No more low-cut clothes. Her hair was, its natural color. It was so cool.
That has to make you feel so good.
Oh, it was awesome. Especially when you see a young person young women in particular, with all the messaging they get, are so vulnerable. And to see someone at that stage of their life feel so much better about things.
In a brand new life, kind of. That was a brand new thing.
Those are the most fun things.
That seems like the most rewarding thing, like about what you do. Like if you think about one thing that's always like hit me so hard is like of anything, like somebody, like if they were missing a tooth or something, you see that a lot with people who got on drugs or whatever. Like if I had tons of money, that's one thing I feel passionate about because giving somebody back their smile, you're giving that girl back her confidence and she's so young, that's when it really matters because that changes somebody's whole path of their life. Like just feeling like saying hi to people, and being out there in the world. And, so I've got so many questions for you. Like, what if somebody comes in there and they're like 20 and they're wanting like some kind of surgery, like an eyebrow lift or something? Like, what do you do?
You have a long conversation usually, or else a very short one.
Because they're old enough. I mean, they're old enough technically.
So they are old enough, and that's the thing is they are old enough, but yet they're not. We have 3 kids. We have twins who are 29 and a 27-year-old. So I can relate. I mean, I'm old enough where I don't remember exactly what it was like being 20, but I do remember thinking that I sure as heck knew a whole lot back then. But especially when you've got kids, you've recently been through it, you realize what a 20-year-old knows and what a 20-year-old doesn't know. And there are times when you'll see exceptionally mature people who have their head screwed on straight and they're completely rational and they're not being unreasonable. And I always really drag my feet and I usually try to talk them out of it. In many cases, they'll bring one or both parents, which they don't have to legally, but I think it's a great idea. And I'll sometimes ask if there's other people who are important to them who have an opinion about what they're thinking about doing.
That's really good.
Because sometimes their relationship with their parents isn't great, but there's some other relative or a significant other already or whatever it is. But if they convince me that they really want it, and physically they would just got in the low brow line and they were born with low eyebrows, and they say, here's the biggest thing for brow lifts. If someone says, yeah, when I wash my hair and put a towel around my head, it feels and looks so much better. That when they say that, that means they're going to be happy with the brow lift.
Yeah, yeah.
And if they say the right things and they've got the right physical findings, and usually what I'll do is I'll bring them back a second time and have another discussion. Sometimes you got to make up a reason to see them one more time. But if they seem to be completely legit,
I think that's
then
so
I'll do
smart. Like, our daughter, when she turned 18, she's still in high school, but she thought, I'm 18, I'm grown. You know what I mean? Like, and so she wanted a tattoo, and I don't have any tattoos, but I might get one. I'm just too indecisive. But she wanted a tattoo, so I decided, okay, I'll go with her to get this tattoo. And I'm not going to tell her she can't, because she might go get it without me. And even though she's a senior in high school, she told me this for years beforehand. She loves the Beatles, and she wanted this tattoo from, it's something to do with Apple Records or whatever. So I went with her because I knew she was going to get it anyway. And I was glad I went, so she didn't make it way too big. You know what I mean? But once they turn 18, it is their body and their decision. And she had wanted it for a long time. She also got a nose ring, which I was like, don't get a nose ring until you're out of the house. But she got one. Now I like it. I think it's cute. She's got a little loop. But I feel like sometimes you can kind of tell, sometimes somebody got told something when they're young and then they're thinking it. I love that you get other family members, to chime in, because that can make a big difference, on what somebody does at that age.
Yeah, for sure. I mean, like you said, they're legal, but that doesn't mean that they're in a position to make decisions that can have lifelong implications.
I think having kids does that. Having kids makes you see, well, you may feel this way right this second. You know what I mean? But so can you spot like body dysmorphia or whatever? Can you spot it quick? Is there body and facial dysmorphia?
It's all one thing. It's all body dysmorphic syndrome. And there's varying degrees of it. Because if you think about it, as I tell people, normal's a setting on the dryer. None of us are normal, okay?
Yeah.
We all have our things. We all have stuff that are our pet, whatever, peeves or things about ourselves that we're insecure about. And it's just a matter of how extreme the body dysmorphia is. So if it's extreme body dysmorphia, yes, it's very obvious. And actually, I've gotten to be pretty comfortable asking those people if they want to talk to someone about it.
Yeah.
And they're usually thrilled that you asked. I had one patient who I was convinced had body dysmorphic disorder, and I was just certain of it. And she went on and on and on about her neck. I said, look, and then she wanted to talk about this and talk about that, and then her neck and this. And I said, you need to get your neck fixed. I said, I'm not going to talk to you about anything else till you get your neck fixed. Because she was asking about stuff for her eyes and her face, but then she kept coming back to her neck. And I said, you know what? Get your neck fixed. Because I don't think you're
How old was she?
50. I said, I don't think you're going to be happy with anything on your face until you get your neck fixed, because that's all you can talk about.
Yeah.
And I was sure, and she had driven from several states away to see me. I said, there's no way I'm going to see her back. Well, sure enough, she went, she got her neck fixed. She said, okay, I got my neck fixed. I'm happy with it. Now I want you to work on my face.
Oh, shit.
I'm like, okay, you know what? Good for you.
Yeah.
And
what's the best way to get your neck fixed?
She needed
do?
surgery. I mean,
like what kind of surgery?
She needed a lower face and neck lift. I mean, she just needed to have.
Are they two different things?
Well, in young people, sometimes they can do a procedure where they just work in the neck, but someone who's 50 needs
the whole deal.
Lift. Yeah.
So, okay, I got a question. I don't think you do this. One thing I love about you is that you're not like just got the knives out ready to,
Right.
do shit like that. But that's one thing I really love about you, because there's other not as invasive ways to fix stuff. But I don't really know anything about it, but I'm curious. Not that I'm going to do it because I'm too worried about. I don't want to get addicted to pain pills, because it's in my family. But I'm curious about that Forever 35 facelift, that deep plane. Do you know about that?
Mm-hmm.
What's that? What is that?
So deep plane facelifting has been around for a long time. It's just a surgical technique for ways to lift the face. There are advantages and disadvantages, like there are everything else. There are good candidates and there's people who are not as good a candidate. It just depends on the individual. But yes, there are things you can do during facial rejuvenation surgery that can make people look great. But there's also things that can go wrong. So what's interesting to me, Aimee, is that the pendulum swings back and forth in aesthetics. So when Botox came out in 2002, was the beginning of the I don't want surgery type of revolution. And then everyone kind of was shying away. And then fillers came out in 2004 in the U.S. We had collagen before that, but the first hyaluronic acid filler was Restylane. Came out 2004. People started using filler for all kinds of things. Juvederm came out 2007, and they marketed really aggressively, and things just kind of exploded.
Is Juvederm filler?
Juvederm is filler. Mm-hmm. Juvederm and Restylane are both brand names of fillers. But when those two brands hit the market, it became a thing where all of a sudden everyone wants injections, and people are like, oh, I don't want the risk of surgery. I don't want, you can have complications and it's a lot of recovery and blah, blah, all this stuff. And then people started getting treated by injectors who weren't very experienced.
Yeah.
And they started getting too much filler, and they started getting injecting too often. And then all of a sudden people think filler's a bad thing. Well, surgery's not a bad thing and filler's not a bad thing. It's all good if it's used the right way.
Who's doing it?
Like we were talking earlier, you can talk about, guitars, and there could be different guitars, and, depending on the player as to how it's going to sound. A bad player is not going to make a good guitar sound good, quite frankly. And a good player is going to take any guitar and make it sound good. And, you just got to use the right tool by the right person to get the right result. And these pendulum where it's no surgery, all surgery, now I'm a surgeon. And I do non-surgery. So I'm happy kind of whichever way. But when I was probably in the earlier part of my career, people would come in and the first thing they'd say is, I think I need surgery, but I don't want a brow lift. Because back in the 90s, brow lifts were done very differently, and people looked,
they look scared, kind of.
That's like deer in a headlight. Nowadays, I cannot tell you how many people come in, these young women, like you said, early 20s, saying, I think I need a brow lift. They completely, it's like I went through a portal into a different universe. Where in this universe, nobody wants a brow lift. In that universe, everyone wants a brow lift. It's so crazy, but it's just the pendulum swinging back and forth.
What do you think gives them the idea? Like they need a brow lift, like when they didn't use
social media, because they see people who, I like to think the brow lifts I do, look natural. And people like them, and people look and they say, oh, that actually does look good. And sometimes it's, like you said, you mentioned the Kardashians. It can be some celebrity or someone who they follow on Instagram. Not even, it could be an influencer.
Yeah.
On social media had a brow lift maybe, and they say, oh, that actually looks good. I want to do that. Or
What do you think filters have done? Like Facetune and the
terrible.
filters. Like, I saw a girl at these awards that, like, I've known for a while, but I hadn't seen her in a few years, but I've been seeing her on social media. And then when I saw her, I had to ask somebody, is that her? Because she looks so different in person than she did on Instagram. I just didn't even believe it was her. I don't even know what she's doing on Instagram to herself to make her look so different.
They're devastating, quite honestly, because it makes people think that that's how people really look. It's sort of like when people, who have 4 kids and a hectic life. And I mean, no one's house is neat and no one's life is organized when you got 4 little kids. It's chaos nonstop. But yet people will take, the little clips they put together that make the one moment of a day when things might have actually been calm, and they post that picture. And then other people look like, oh God, how come I have 4 kids and my life is a mess? And she has 4 kids and her life is just perfect. It's like, no, it's actually not. That was the one moment where things looked actually somewhat less chaotic than they know. But don't think that they really look like that. And don't think that you should look like that. It's awful, those things, especially for impressionable people who are at stages of their life where they are vulnerable, whether it's because of relationships or
we always joke about like those
awful.
Cards. We would get these Christmas cards. Like, I'm sure y'all got them too. Like on the beach, everybody in white. Everything's perfect. Then I'm thinking I would love to see this picture 5 minutes before, when the dad's killing a Bud Light and the mom's like crying, the baby just pooped, just the chaos, because life ain't like that. And I don't know why people believe, when they see these things, and then you have those nutcases like that one lady that went to jail, like, I don't remember her name. It was in Mormon country. And do you know what I'm talking about? And she went to jail, and like her kids showed up ringing a doorbell, starving. Like these people, I don't know. It's crazy. They believe this is even a real thing.
But why do people watch that stuff on TV? I mean, they watch Christmas movies because they're beautiful and have a happy ending. Well,
they want to be like that, I guess.
There's a part of everyone who loves a fairy tale, and they love that type of thing, and they want to believe that life can be like that, but it just ends up making them feel worse about their own life.
I think that's kind of like, I watched the Kardashians. I fought it forever. And then my mom just kept talking about them like we're cousins or something, like they're our family. Like, she knows them all. She knows all their stuff. So then I started watching it, and it is addictive. Their family's insane, like insanely addictive. The chaos, like Kim Kardashian having 4 kids with Kanye West. That's going to be entertainment for a lifetime. And so, I got way into that show, but I could tell now they're starting to kind of reel from the criticism they grew up with. Like, you can tell, like if you look back 10 years ago, like, they've all done things like, I don't know. I think they grew up in a critical, under a microscope of like, you need to fix this, you need to fix that. And like, I feel like, I don't know. I feel like that's had a big impression on, I don't want to talk bad about anybody because I actually like them and think they're good people. But, I think it's had a big impression on how people judge themselves. Like, they might think that they should be that way, but they don't understand like the things like that lip kit thing. I don't know if you know about the lip kit that made millions and billions probably, but she had lip injections. It ain't like that lip liner did that. You know what I mean? Like, do you see? I am curious about those lip injections. Like, do people want them bigger and bigger and bigger and bigger?
There are some who want bigger and bigger and bigger, but that is just not my style. And we just break up.
Do you just say no?
Well, what I tell them is I do say no, but I don't want to be rude about it. So usually what I say is, look, you feel that your preferred look, your aesthetic is lips that I consider unbalanced for your face. It's just too large for your face. So the problem is this: you want one thing, and what I see when I'm doing injections is, okay, I think we're done. But you're never going to be happy when I think we're good. So how do we work together? Because what you want isn't what I see as being good. And I'm never going to be able to make you happy.
Do they stick around, or do they go find somebody to do the bigger, like?
Some of both.
Because sometimes you'll see somebody and just jump back a little bit, like.
Yeah, I just won't.
It's like
now,
balloon animals or something poking out.
I'll see people for the first time, and I'll suggest dissolving some of their lip filler.
So say you got lip filler and it was too big and weird looking, you can fix it?
For sure.
How do you do that?
Just inject some stuff that'll dissolve it.
So what if somebody got filler in their face and wasn't happy about that? Can you dissolve it too?
Yeah, I use ultrasound to help, like you would ultrasound to look at a baby. You can use ultrasound to look at the face, and you can use it to figure out what's filler and what's your natural tissue. And we actually use the ultrasound to guide the injections that we do, so we can make sure that the needle goes right into the filler. Because if you don't get right into the product, it won't go away.
Well, a lot of people do Botox. A lot of people do injections. That's one thing I've learned. Because when we spent the summer in California, and I was telling you a little, I went to this lady, like, she should not be in business. Like, I don't know what her deal is, but she had good reviews somehow on one site. She had terrible reviews on a different one, but I think maybe they did those reviews on the good side. But it's like she just stabbed needles in my face. Like, I'm so glad I had some meetings. I'm so glad they got canceled, because I even had little blood clots and little bruises, and like, it was happening in the office before I left. And it scared me off of everything for a long time, because I don't know what happened.
I mean, like anything else, like being a musician, there's people who do it well and there's people who don't.
I think that's why it's important, that you know where the muscles are, where everything is. Because I feel like a lot of people just think they can do it when they don't know what they're doing.
Well, the barrier to entry for doing this stuff is really low. I mean, people can go and they can sit in on a weekend course and they can get a certificate that's not worth the paper it's printed on. And they're legally, if they're a nurse or a PA in the state of Tennessee, even an esthetician, can be licensed to go. It doesn't mean they had good training, but I'll also tell you that just because someone is a doctor also doesn't mean
they're good at it.
That they know the anatomy, that they know the nuances of the drugs and all that stuff. I mean, it really comes down to who's not only qualified, but has experience and knowledge.
Like, even if they didn't have a major degree, but they do it a lot and they've learned. Is that what you mean?
There are some who can be excellent, yeah. I mean,
just because the more you do something, the better you get.
Well, if you're, it's like anything else. If you're really smart and have a desire to learn something, whatever it is, and you dedicate yourself to really learning it and studying it and becoming a true student of the art, yeah.
I'm self-taught. Self-taught.
You can do that.
Yeah. I totally get that.
You can do it, but it takes that type of commitment to do it, because there's an awful lot of people who write music who don't do it as well as you do.
Well, Chris always says it, and I feel like it's so true, about 10,000 hours. It takes 10,000 hours to master anything. So you can get good at it at 3,000, but it takes 10,000 hours to master something, to be real. You know what I mean? Like, to be able to, somebody might be able to write a song and they've only written 5 songs. They might have a lucky break. But to keep having hit song, like, like one thing is you got to learn, like I see this a lot with writing songs. If somebody's like a newer songwriter, like I see what's down that road and around the corner. I already know where we're going wrong. You know what I mean? And I try to tell them, but I also try to listen, even if they're new. I try to listen, but I can spot what's going to happen. Like, first of all, in a song, you don't want the person singing it to be not likable because nobody cares. It's just like a movie. If you're not rooting for somebody, then nobody likes nobody. Why watch it if you're not rooting for somebody? But there's little things you learn like that, and I think you just learn it from doing it.
There is no excuse for experience. But I will tell you, for me personally, like when I finished my training, I thought I knew a whole lot. And the longer I do this, like I said, I've been doing it 33 years. The longer I do it, the more I realize I don't know.
Yeah.
The more
I'm with you.
You realize you see something. I saw something today. It's like,
what was it? What was it?
So and there's always some type of curveball or something.
Yeah.
Right? So this woman came in. She was referred to me by some other doctor. I can't remember who. Not important. She had a little spot on her lip. And like, okay, little blood vessel type of thing. Then she said, and I got this thing in the back of my lip that ever since I got inflammation when I was having dental work done, I was like, what are you talking about? And I said, well, let me look at your lip. And I pulled her lip down and she had something on the inside of her lip that I was like, maybe this is a weird vascular anomaly. I said, honestly, I'm not sure what this is. And I don't know for a fact that it's causing the little red dot on your lip. The red dot in the lip, I treat a zillion of. That's easy. But a red dot in the lip, when you got something weird in the backside, I don't even know. I said, I think you should see an oral surgeon because I just want to get an opinion as to what they think that is.
It's causing it.
Because she was most concerned about the red dot. And what as tempting as it was to say, well, I can treat a red dot, when you got something weird behind it, I don't know that it's not connected. And rather than telling her, well, you probably got two separate things when I don't know what one of them is, I said, let's just figure out what's going on here.
Yeah, because it might come right back.
Exactly. That's what I told her. I said, yeah, we could treat that thing and it either won't go away or it'll come right back, when most little red dots will just go away.
What'd she say?
Well, she was actually bummed for a while. And I said, and she said, I don't want to have oral surgery.
She just wants you to fix it.
I said, you don't have to have oral surgery. I don't care if you don't have oral surgery, but I'd like to get an opinion from someone else who can give me a sense of what they think is actually happening here. And if they think it's blood vessels and you don't want surgery and you want to try to treat it with laser, well, we can do that. I said, I just want to be able to tell you what to expect and to make sure we do the right treatment for you when we do it.
Do people have like crazy expectations sometimes?
So if we had a conversation like that and all she heard was that I would treat her with a laser and she was going to be fine, then I wouldn't treat her.
Yeah.
If she happened to be at the end of the conversation, she was very reasonable. But when people have expectations that are clearly not in line with reality.
Can you spot that pretty quick?
Usually you can, yeah. Every now and then one will slip through. But yeah, it's one of the things about your 10,000 hours. Like after 9,999, you start to get a sense of who you just need to say, no, we're not going to do this.
It's so weird how so many professions are the same when you break them down.
Oh, sure.
You know what I mean? Like whether you're like a mechanic putting together a car or working on a song and like, you know what I mean? There's so like the technical parts, like it's not going to work if you do this, and it's obvious if you've done it a long time, but it's the same way, I guess, with like doing, some people come in, I bet, and they're not going to be happy no matter what you do. You could probably spot that pretty quick.
As we say, there are some people who are miserable people and they like to spread their misery, and you can just choose to be part of it. And you can let your ego tell you, oh, well, I'm better than those other 4 doctors who couldn't make you happy. I'm going to go ahead and make you happy. Or you can say, you know what? Not one person has made this person happy, and I'm not going to be the next one in line.
It's so
like,
true.
yeah,
It's so
no,
true. When
because-
you start hearing these stories, like, do they come in and just tell you these
Oh, they
stories
do.
of like, this happened, this happened, this
Yep.
happened?
Yeah.
Yeah, I know exactly what you're talking about. Like, okay, I want to talk about some of this like stuff about like cellulite and all that stuff. Like, I don't know the words for it. You like Cabela, is that right?
Cellulite is a really tough problem. Cellulite is, of course, when you get the dimples and the waviness. In only women get cellulite. Men don't get it unless men with prostate cancer who are treated with hormone therapy can get cellulite. But otherwise, men don't get cellulite.
Oh my
it's
gosh,
just
I never knew that.
But 85% of women have cellulite. It has nothing to do with your weight.
When does it start?
It can start in your teenage years. It's got nothing to do with body weight. So losing weight doesn't make it better. Exercising doesn't make it better. There's nothing that's going to really make it much better. And there are some topical treatments that, yeah, they can help a little bit, but there's really nothing, whether it's injections or surgery, that is going to be good for cellulite across the board. Now, there are some people who have cellulite where with injections or certain procedures, you can make it better. But it really boils down to how good quality is the skin. Because if you don't have good quality skin...
Like genetics.
Genetics are just from, as we mentioned at one point, sun exposure, aging.
Does that affect cellulite, sun exposure?
It can. If you have the collagen and elastin in your skin breaks down with ultraviolet light exposure over time. And I'm talking about people, the beach bunnies have been on in the sun their whole life.
Like in Miami on the beach.
Right, exactly. And they're just, as my nurses like to say, the brown as a biscuit. And they just don't have good quality skin anymore. I mean, those patients with cellulite are so hard to
Can you
treat.
fix it at all?
In some people who have really good quality skin and cellulite that's not bad, sometimes yes, and other times. But this is one where expectations have to be low.
Do you tell people?
Oh, 1,000%.
And they still want to do it?
Some do, some don't. And sometimes they really want to do it. And if I just feel like I'm setting them up for disappointment, I just tell them I just don't think it's worth it.
I totally get that. Do any of the injections for fat stuff work?
Oh, they do, for sure. Cabela does work.
What's Cabela?
Cabela is a drug that, when injected, will dissolve fat.
It works.
It does work. It causes a lot of inflammation. For people who have their neck treated, there have been reports that the inflammation caused by Cabela can make surgery, if someone subsequently decides to have surgery, can make the surgery more challenging because of the scar tissue that's created. But I injected Cabela today in someone around their knees. They had a little collection of fat around their knee. They just didn't like it. It was legit. They had a collection of fat. So for people who have focal collections of fat, maybe they've had liposuction and they got little pockets here or there.
And they're self-conscious about it.
Oh, yeah. Very
People
self-conscious
get
about it.
so self-conscious about stuff. It's got to be a great feeling to make them more confident.
Oh, it's really fun. Yeah. I mean, it's so gratifying.
Especially like you were saying, that young girl with
Oh,
acne
yeah.
scars.
That's so gratifying. It really is.
I mean, like, that's the kind of thing I would think, like being a doctor and you see you're changing this person's life. You know what I mean? Like, you're changing how they enter every room.
I mean, the reality is, yes, you can't go through life thinking that way. I mean, I'll be honest with you, Amy, it's kind of a weird thing doing plastic surgery.
I want to know everything. I want to know it all.
Here's the deal. If you don't believe that you are the best person in the world to be doing something, then you got no right doing it. If you think that someone down the street probably is better than you, well, then the ethical thing to do is you better send your patient down the street.
Do you ever do that? Like, I'm not so good at varicose veins, so I'm going to send you down
all the time.
here
I
or
refer
whatever.
stuff out. But if you're going to do surgery, which I do, at some level you got to believe you're the best person to do it.
Yeah.
By the same token, you can't go around acting like you think you're the best person in the world at something. That would be.
You can't be the best at everything. You know what I
everything,
mean?
but you can't even go around acting like you think you're the best at anything, because you're one surgery away from some weird thing happening. And just because you're talented doesn't mean that every song you write is not going to be a number one hit. It just isn't.
Yeah, it just ain't even close.
There's other factors that come into play. Whether they're out of your control in many cases, and it's just weird things happen. And
I would love to see the difference in somebody when they come back in for their checkup and they're so happy and confident, especially if it was somebody who really went through a hard time. You know what I mean?
Mm-hmm.
And they were really not feeling good about themselves, and then they come back bright-eyed, and that's got to be the best feeling.
It's super gratifying. It really is.
I mean,
it really
I
is.
just I always think, for some reason, I always come back to teeth and stuff. I can't stand when somebody won't smile. You know what I mean? Because they're self-conscious. And then all of a sudden, if they get teeth or something, they're just smiling. So I just love when people smile. It's just happiness.
It's really gratifying. It really is.
And just knowing some of these women, maybe their husband left them or something, and they come in feeling hot again. It's a great thing, I'm sure.
It's so nice. And I mean, there's other things that we'll do that are super gratifying. There's, unfortunately, Nashville is a hotbed for human trafficking.
Oh, shit. I didn't know that.
Oh, yeah. And there are women who have been essentially rescued from this whole world of being abused and sex slaves and all this stuff. And there are organizations that help rehabilitate them. But sometimes people have had tattoos put on their face, and they've had, they've been burnt intentionally by pimps and things.
Oh my gosh, I didn't know you dealt with stuff like that.
Sometimes do some pro bono work on some of these.
Is that the best feeling?
Where, oh my gosh, I mean, it's the types of things that we do. I mean, we don't do free tattoo removal just because someone doesn't like their tattoo. But if someone was, as part of this world, someone, put a stamp on them like I own you, and it's on their forehead or their cheek, that's going to make it difficult for them to
ever do anything.
And every time they look in the mirror, that's what they see. So sometimes we'll do work where we'll.
I did not know that. That makes me so happy.
Another one is people who've had cancer and had to get radiation. When you get radiation, they make these little tattoo marks so they can line up the radiation in the same place each time. And we'll take off the radiation. When someone is done with their radiation, we'll laser off their radiation.
Because it reminds them every time they look in the mirror.
Mm-hmm.
That's probably the most gratifying,
very much so.
That, and then the tattoo thing. I did not know that about the trafficking thing.
That's unfortunately Nashville's.
There's a lot of crazy shit going in Nashville. People don't know, the whole thing with people drugging drinks. You know what I mean? They hide it. They hide it a little bit because downtown, having a daughter who's 18, we know about all that stuff. This wasn't something I had to worry about, and we're just telling her. The first time I ever saw anybody talk about any of this, it was a Christmas party, and Taylor Swift was saying she was telling somebody about when she got her water, to keep the thing, the lid fastened or what, so she could break the seal. I'd never heard anything. I didn't know anything about any of this, never heard of it. And then I read a couple months ago that Nashville's one of the places, because all the bachelorette parties, I think. everybody's coming here and partying downtown. And they were saying some of the bartenders were in on it.
Yeah, there's all kinds of crazy stuff that happens.
So what's the deal with the trafficking? I didn't know anything about this. How do you find the patients from that?
So there's organizations in town that specialize in helping these women. I don't honestly know how the women get from the streets into these organizations, but they're carefully vetted, and they're usually we're contacted by someone from the organization who will say, well, we've got someone who's got a scar someplace, or she's got, tattoos that we want to see if she's a
I can't even imagine how that feels. Like when you're talking to them, when you do it, and then after it. Is that the best?
No, it's very satisfying. It's really nice, because then you feel like you're really in a position to help someone get their life turned around.
It does turn their life. I mean, I can't even imagine having a tattoo on my face like that reminded me of something horrible.
I mean, not only remind you, but every time if you try to go get a job and someone, potential employer is looking at someone who got a tattoo in their face, people pass judgment, whether right or wrong, good or bad. I'm, not making a comment. It's just the natural thing is we have an opinion in our culture.
People are judgmental about everything.
Yeah.
That's what I'm talking about with teeth. Like, for some reason, teeth have always been a thing to me, like, just because people judge so harshly with tattoos on the face and probably teeth, probably anything on the face, like when you're talking, like, and I was reading something about, like, that it's the shame, these people have the shame of having either of those things, like, and it affects everything they do. Like, because it would be hard to go get a job, like you're saying, like if I just didn't know. I mean, I just didn't know. People are so cruel sometimes. That the fact that you do that just makes me love you more. I mean, that's
sweet.
just, I love that you do that. I didn't even know you did that kind of stuff.
Sure.
I mean, doing your job, that has to be the best thing. I would think that's got to be the best feeling.
It can be very satisfying, for sure. I mean, I'm so fortunate to have a job that allows me to do this type of thing and to help people.
Because you're across the board. You got the Belle Meade ladies, that like are just nitpicky. And then you've got people that are like never thought their life would be different. And you get to make it different.
I'm extraordinarily fortunate. And Nashville has been so good to me over the years. The music community, the social community, the business. I've just been very fortunate. I'm very grateful.
What are the new things coming that you think like people should know about? Like, I love the thing about like what's a liquid facelift, first of all? Like, does it make a big difference?
So the whole concept, the liquid facelift isn't a specific treatment. It refers to using injectable fillers to help people look a lot better. And yeah, that's a real thing.
You can see a big difference?
For the right patient, for sure. If someone's got really good quality skin and certain types of changes, you can make a really
What
big
about
difference.
like somebody's jowls? That
jowls,
word.
if they're mild, yes, non-surgical treatments can be really helpful. But if there's moderate
problems,
or severe, they just need surgery.
What kind of surgery?
Facelift.
Oh, fuck, a facelift. That just seems so... To me, a facelift just seems like a roll of the dice.
And again, it depends on the individual's anatomy and who's doing the surgery and all that other stuff.
It's a lot of things
then. A lot of
then.
factors.
Not just the doctor. It's like a lot of things.
There for sure. Because some people's anatomy is just such that they're never going to have the jawline that their favorite celebrity has, because they just don't have the same bone structure.
Do people bring in pictures of celebrities?
They do sometimes, for sure.
What do you do?
I look at them, and sometimes I'll say, yeah, no, you just don't have that.
That ain't going to happen.
Facial structure. Like, let's forget about that. It's not going to happen. Or like, oh, okay, I get what you're saying. Let's see what we can do.
Yeah. Because you see a little piece, you can maybe make a little bit like that.
Yeah. I mean, sometimes if they have the underlying facial bony structure, then sometimes you can do that. If they have too much elasticity, they'll need surgery. But sometimes even with surgery, if the structure's not there, you're not going to look like someone who's got a different bone structure. You're just not.
Yeah. That's like a singer, kind of like if they sing one way, but they want to sound like this part, like they want to sound like Adele, but it's never
Right.
going to happen.
You're not gonna sound
Like, I
Adele.
mean, you can try to take some voice lessons and learn how to breathe, but that ain't ever happening, their tone, because you can't change your tone as far as a singer goes. It's probably the same with skin. Like,
Oh, for sure.
and, okay, so I got one last question. No, two or three. Last questions, like
Go for it.
what are you most excited about, like in your job? Like, do you think could help, the majority of people? Like, what are you excited about? Do you think will make a big difference, like that people will be using in a few years?
I think that one of the things we're working on now is drugs that we inject that they don't act like the gel fillers like Juvederm and Restylane, but they act by making your body produce its own collagen and elastin. So those are really cool. And they've been around for a while, but it's sort of like an idea that was before its time, that now that we're getting to a point where we can appreciate them, there's a lot of research into them. And I think that's going to be a big thing. There's a lot of regenerative medicine stuff that's coming out, which in aesthetics is going to have a bigger and bigger role. And I think that's actually, again, how to make your body healthier, how to make your body produce the things that it needs in order to look good. So it's aesthetics, but it's aesthetics because your body is healthier.
And your body's kind of doing it.
Because it's repairing itself when you help it do so. And there's different ways to do that in some of the newer drugs. I think some of the longevity stuff that's going on is really
Like
cool.
what? Explain the longevity.
So longevity, in terms of a way to understand it, we traditionally think about when you think about how long does someone live, you think about their lifespan, right? So you live to be 85 or 90 or whatever number is. What we talk about now is health span. So it's not how many years do you have, but it's how many quality years do you live. And how many often do you hear someone say, yeah, they were 90, but for the last 10 years, their life been terrible. What we're talking about now is ways to extend the period of time,
the good part,
that you can live well. And so we're just at the very early stages of some of this stuff. And I think it's fascinating.
Do you think AI is going to make big changes in this stuff? Like,
I think in some areas, yes, but there's always going to be, always. For now, it appears that we will need human influence to help manage the AI, because AI is very good at doing certain tasks.
Pointing out problems.
But, it can point out problems, and it can, if you tell it how to solve certain problems, it can do it. But what it doesn't have, and it's a whole nother step into doing, is being able to assess a situation and come up with an opinion that requires a lot of human experience to do. For example, sometimes you look at someone and you know something's not right. It's hard to know what, but they look sick. Something does not look right, and it doesn't fit an algorithm, and it's the years of experience that something is not right. You don't know exactly what it is. Or that someone is saying things that aren't adding up, and there's something that's off, and you got to figure out what that is. Unless someone knows the answer, you can't teach AI
oh yeah,
how to do it. So there's, I think, going to be a tremendous amount of improvement that AI can bring.
it can give you information kind of, but it can't solve the problem.
It can solve some problems, and it can take a lot of information and very quickly assimilate it and boil it down for you. But AI also is sometimes not correct.
Oh, I know. I'm so over AI. Like our kids hate AI.
You got to just be careful about it. And when it comes to making medical decisions, you certainly don't want to take the chance that AI is hallucinating and come up with something that's not really realistic.
Sometimes it'll just say shit that's so crazy and not true. Just, it's like, what are you doing?
But it doesn't know that it's being crazy. And it's telling you.
It just kind of does weird stuff.
Yeah, it does.
I mean, like, that's one thing with, I don't know if you know about, like all the songwriting stuff, Suno. Anybody can write a song and use this app, Suno. And so now I know people, they're sending us songs every day, you know, they made on there, but you can always tell the vocal. Instantly, I can tell the vote. I mean, it's like cool. There's not a human element to it. And it sounds like it's kind of the same, like you have to, like Suno can only do what's already been done. It can't do new things. It can't surprise you. Because it's just going to do a generic thing that it's heard and learned, you know, from repetition. And it seems like that's the same. It's weird.
Same thing.
It's weird how they're the same to me.
Yeah.
Like,
that makes sense.
So what do you think is like the best thing somebody can do if they want to look younger? That's like probably my final question. Like is everybody different, or is there one thing that most people can do?
Honestly, what I focus on, Aimee, is what is someone else going to notice when we're sitting like we are at a comfortable social distance. You're at a party, you're across the table from someone, you're at a meeting, you know, across a room. What is someone going to notice that would make them look at you and say, "Oh, they look really good"? And I think the most important thing is having great skin.
Yeah.
Because if your skin is really pretty, the little wrinkles or lines or, you know, other things, whether your eyelid's a little droopy or whether your lip's a little bit thin, you don't see that as much. But if your skin looks great, then I think that's probably the single most important thing. Now, when someone's going to take their 10X mirror, and I tell them what I look for is, let's start with what someone from across the room is going to see. And then we'll hone in on details. And if you tell me, but I'm really bothered by my eyelid or my lip or my nose or whatever, well, then fine. We'll talk about that and see, well, what do we want to do for those things that bother you? And sometimes I'll say, you know what? Your eyelids are way out of sync with the rest of your face. And that's just the line you got in. And I'm sorry, but you need to do something about those eyelids because your eyelids look old and the rest of your face looks young.
Yeah.
But if you want just global, how do I look good? It's have beautiful skin.
And sunscreen, you think that's a big part of it?
Huge, yes.
Okay, can you really get rid of sunspots? Is that possible?
With lasers, yeah.
Like they'll really go away?
They really go away, yeah.
Because I got one I really don't like. Like, I really don't like. And, like, it's weird because people say you have the prettiest skin, but it's like you just see your flaws sometimes. You know what I mean? Like, I've got, like, 2 sunspots that I hate their guts. Like, I just want them to go away, but I never really believed could they really go away.
They can go away.
I mean disappear.
If they're light in color, they can be harder to treat. If they're dark in color, usually they can disappear. Yeah.
Really? So if they're light, that's not good. If they're dark, that's good?
Usually, yes.
Okay. I'm going to come see you. We're going to have to deal with this over here, this one, because I want to get rid of it. I don't like it. Like my mom, I think, is that hereditary?
They can be. Yeah.
Because my mom has like sunspots,
yes,
but I try to wear sunscreen, but still you get like, you know what I mean?
Some
all of a
do.
sudden you look in the mirror, it's like, what happened? Okay, I'm going to come see you about that. And then maybe I'll just like keep a track of it because I hate it. I know right where it's at too.
Okay. If it bugs you, sure.
I was going to go on Shark Tank with an invention about like these little things like Band-Aids you put over it, but then you're just going to have a different spot. Like it's if the sun, like it'll protect that area, but then it'll just stand out more.
Well, I think that it's worth taking a closer look so we can see what we can do. But a lot of times you can make them go away.
Okay. I'm going to try it.
Sure.
Okay. This is Dr. Biesman in Nashville. He is awesome, and I recommend him to everybody, and he'll do you right. That's what I think.
Aimee, you're awesome. Thank you so much for having me. This has been really fun.
This has been really fun and educational, too.
Okay.
You guys rock. Thank you for watching.